Hey there, it's Dr. Appleraju, your downtown digital general dentist. And today I want to talk about something that we've seen over many years, and one of our coaches pointed it out, being in multiple offices all throughout Canada and the US. So it's an interesting phenomenon we tend to see in dentistry, and that is when patients come in and they don't have any pain or symptoms. We often will diagnose as a new patient. We'll do some assessments, some x-rays, some scans and photos, and we're assessing them. And quite often, not everybody, but some people do have cavities that don't hurt them. And we will always prescribe treatment for those cavities where we're concerned. And we want to get those teeth healthy so that these patients don't need further treatment. However, patients will often go to the front desk and nothing hurts and they don't want to book anything until some point down the road. We can't predict the future, but when things hurt. So one of the things I heard is that, it's difficult for patients to understand why they need treatment when things are not hurting. And it is a preventative strategy. We don't want things to get worse in your mouth when you're diagnosed with cavities, for example, because we see the side effects, the downstream effects over and over and over again, meaning we see people that don't have their treatment done, and what happens down the road to those same patients. Now, I'll give you an example. So a patient has, a few cavities, maybe it's one, maybe it's multiple, maybe it's quadrants of dentistry they need, but nothing hurts. It's magical. They feel great. However, quite often, 6 months, a year, 2 years, maybe 5 years, sometimes 10 years, very rarely, those same patients are back. They're calling our office because they have a major toothache happening and they can't function. And we will see those patients and we will obviously get them out of pain and take care of them, but we are still advising them to get the treatment that they have been prescribed. The problems do not magically go away. And there are some barriers there. One of them is patients that are not in pain don't seem to think they have a problem. Maybe there's a financial barrier or insurance barrier or benefit barrier, whatever that looks like. However, we don't want these things to limit the care that you get, because we do see the side effects of non-treatment or non-compliant patients that don't do the care. They tend to come back and it's very, very bad. It is not nice when we see patients and their faces are swollen and they're in severe pain and they are crying in our chair and they want to get out of pain. Dental pain is not not something to be taken very lightly. It is very, very uncomfortable. It's almost considered one of the worst kinds of pains you can have because it's in your mouth, and very close to your mouth is a lot of nerves and blood vessels and your brain. And most patients cannot function when they have a major toothache. And our goal is to educate our patients about what's going on in their mouth, guide them and coach them to improve things, but also to take care when they need the treatment. And the only way we can do that is when we have a partnership of trust and rapport with our patients to get them in and get that care done, because things don't just get better magically. We wish we would have a magic wand where we can do miracles, but unfortunately we can't do that and make cavities just disappear. So we tend to track and monitor some patients. Other patients, we make a recommendation and prescribe fillings or restorative care to make sure those cavities don't get worse. I hope you found this video useful and informative. If you did, hit the like button. If you think somebody else needs to hear this, maybe forward it to them. If you are looking for a new dentist, we'd love to see you. Book online, just go to www.conceptdentalreddeer.ca and hit that hit the book now button, and it takes you 2 minutes. You can get in, or just pick up the phone and reach out to us during regular business hours. We'd love to see you. And if you have another dentist you love to see them, go and see them too. We just want you to get the care you need and you deserve. Take care, stay well out there.